As we said previously, the PCI sterile procedure performed under local anesthesia. The patient is placed on the heart table and the catheter inserted through femoral, radial, brachial artery guided catheter, and this monitored by a C-shaped camera. Lesion assist confirming severity and vessel diameter for appropriate بالون and stent sizing. وبعدين بنحدد شو هو البالون والشبكة المناسبة لحجم الارتري وحسب الاوكلوجن الموجود. The patient may be given 5,000 to 10,000 unit heparin during the procedure to prevent any clot formation. Balloon dilation catheter and stent system introduced into the guiding catheter. بعدين بندخل البالون أو الشبكة خلال الفيمورال artery and at the tip and confirmed by fluoroscopy and contrast injection. ثم تحقن مادة ملونة ونحدد the degree location of obstruction. Then the stent will be implanted at the place of obstruction, inflated and placed at that place. The dye injected after each inflation to assist the opening. This is an important point, that the dye injected after each inflation to assess the opening, assess the need for additional inflation, and everything is removed after the completion of the procedure. Successful dilation reduction of stenosis by 40 to 50% without complication. There are different reasons for procedure failure, like total occlusion that prevent crossing of the artery, وهذا الحكي حكيناه قبل شوي. Rigid lesion make the balloon unable to dilate. Immobilization of a thrombus is another cause for procedure failure. Result: success rate 85 to 100%, mortality 1 to 2%, very rare, لكن it may occur, and so that we said previously that the emergency equipment should be available. Assessment حكينا عنها بالكارديكات ما راح نعيدها. ال pre-op preparation والmedication. Patient with diabetic should hold metformin. لازم يكون MBO. قلنا كل النقاط هاي حكيناها لما حكينا عن الكارديكات. Emergency equipment, advanced cardiac life support should be available. ECG monitoring. We have to assess the patient's sensitivity for the contrast media like urticaria, حكة, anxiety, nausea, laryngospasm, تضيق في مداخل في اللارynx. Active coagulation time ACT measured at baseline before 5 minutes after heparin bolus اللي هي قلنا من 5000 ل 10000 unit and every 30 minutes. Then after that ACT level 250 ل 300 250 to 300 second required. Management during PCI to teach the patient about everything like bed rest 4 to 6 hours and bed rest supine may extend up to 12 hours وحكينا هذا الشيء في لما شرحنا عن الكاث. Leg straight to avoid any bleeding, hematoma, avoid any upright position, avoid use of cuffs, sneezing or moving the bowel, soft fluid after. Monitor the signs and symptoms of ischemia, attach patient to the monitor, check distal pulses, check site for bleeding, apply sandbag, leg straight, IV fluid. كل هاي حكيناها في لما شرحنا الكارديك كاث. Post procedure also coagulation, مراقبة الانزيم, cardiac enzyme, electrolyte, teach patient about lifestyle modification, stress reduction, weight loss, smoking cessation. The patient discharged on aspirin, Plavix, nitrate, calcium channel blocker, angiotensin converting enzyme inhibitors, lipid lowering agent. The complication for the procedure: angina, MI, vasospasm, closure of dilated segment 3%, restenosis ممكن تصير 20 to 30% of cases within the first 6 months the restenosis may occur. Protocol for MI management: complete bed rest in the first and second day. On the third, fourth day, up on chair. Fifth, sixth day, start ambulation if there are no contraindication. Autotherapy: treatment for pain analgesic by morphine, nitroglycerin, and thrombolytic agent. PCI: monitor for complication, activity of daily living, diet, low salt diet, low fat diet, clear liquid in the first 24 hours, prevent constipation and avoid caffeine. Physical activity: graduate resumption of activity at home, provide sleep, rest, and avoid stress.